Hello, my name is Ava Cantu, and I'm a kinesiology major at the University of Texas Rio Grande Valley, and I chose to do my final project on femoral stress fractures in high school and college female long-distance runners. Femoral stress fractures represent about 10% of sports medical injuries and are the fourth most common stress fracture type. They're primarily found in female long-distance runners. There are a couple of classifications. So the first would be a compression fracture. Basically, it is non-displaced and it is seen on the medial or inferior femoral neck where the callus or sclerosis was noticed. These fractures are known to be stable enough to heal with conservative measures and do not require anything extensive like surgery. Then you have your transverse fractures, which would be displaced. They typically begin as a crack on the superior surface of the femoral neck. These fractures have a high risk of spreading from the lateral side and may eventually become displaced. Early diagnosis is crucial to prevent the progression to complete and displaced fractures, which do require surgery. The condition affects those involved in repetitive impact activities like long-distance running and requires careful medical attention for optimal outcomes. When we talk about the mechanism of the injury, we're kind of reiterating what we just said in that last paragraph. It's basically produced by a repetitive and overuse force. So when these long distance runners are obviously running those long distance, they're putting a lot of stress on the femoral neck, and that is what is causing these stress fractures. Errors that can affect their performance and or safety is simply just improper running form, sudden increase in exercise intensity and or frequency, working out for longer periods or at a different intensity than you're not usually used to, can kind of just like put the body into shock. And obviously that's not what you want to do. You want to gradually increase your exercise intensity. Poor footwear, leg length discrepancy if one leg is longer or shorter than the other. The menstrual dysfunction, the irregularity of menstrual cycles, and bone mineral density are closely related because estrogen plays a crucial role in bone health. As a result, female athletes have lower levels of estrogen and experience a decrease in bone mineral density, and this is why the target population is primarily females. Low dietary calcium intake and low baseline bone density / mass, so pretty much just poor bone health. Low lean muscle mass in the lower extremities, and a history of prior stress fractures or reactions. Now taking a look at the anatomical analysis, the femur is the bone's largest body and has a specific mechanical properties. It is basically the bone that makes up your thigh, primarily designed to handle compressive forces, strongest under compression and weakest under tension. It manages significant forces during normal activities. However, during running, it experiences forces 3 to 8 times greater than during walking. So long distance running makes it even worse because it's having these great forces, prolonged for longer periods of time. And then despite its strength, it can fracture when subjected to forces beyond its capacity. Of course, again, the repetitive nature of long distance running will obviously impact the bone to a greater extent. Muscular participation, muscle fatigue reduces force distribution and puts a more concentrated force on specific parts of the femur, resulting in more stress added. We explain 2 main fracture types. So insufficiency fractures, which is basically just having weak bones to start off with and simply just doing a normal exercise, a normal force. And then you have fatigue fractures, which is having normal healthy bones with excessive forces. Fracture locations can be influenced by bone geometry, force distribution, the principal compressive group, the trabecular pattern, and mechanical axis positioning. To name a few conditions that predispose to insufficiency fractures, which were those fractures where you have weak bones to start off with and you're applying a normal force, could be osteoporosis, Paget disease, osteopetrosis, irradiation. Those are just to name a few. I didn't want to name all of them just because I may not be able to pronounce all of them, but those are going to be just a few conditions that predispose to these insufficiency fractures. Moving into the next section, we talk about the kind of breakdown of this femoral stress fracture. So the location is of course going to be the femoral neck or the proximal shaft. The gender that is going to be most affected is of course the females. The league type that is most effective is high school and college athletes. The sports most effective are going to be, of course, your cross country and track, long distance runners, and then the incident rate is going to be 2.26. So females have a higher incident rate because of their shorter height, which results in more force and stress being applied on the lower limbs. Studies show that women develop up to 10 times as many fractures as men when performing the same activity. Stress fractures around the hip or the femoral neck are less common compared to other stress fractures in athletes, so they only account for about 3% of all sports-related fractures. Some signs and symptoms are simply just going to be pain or discomfort anywhere from the groin to the knee, limping, of course, and then tenderness when the area is palpated. Moving on to rehabilitation, earlier we mentioned how those compression fractures could be healed with conservative measures and did not require surgery, while our transverse fractures did require surgery, so we're going to talk a little bit about that right now. Femoral stress fractures are a common injury that can be managed through a continuum of prevention, active treatment, and rehabilitation. Prevention is simply going to be just educating your athletes, the coaches and trainers, so they don't overtrain their athletes, and they're making sure that they're teaching them, the right form and providing the right equipment, like the right running shoes, and parents to identify risk factors. Active treatment is, of course, just going to be rest, activity modification, so just lessening the intensity of the activities, and correction of training errors like the form and improper equipment, and other factors contributing to fracture development. For the actual rehabilitation, you can do protected weight-bearing exercises, and of course, rest is going to be the main one. And then after 8 to 12 weeks of rest and conservative management, individuals may return to activity. However, if conservative treatment fails, operative intervention is typically recommended, which would be going in with surgery. If pain recurs, activity should be stopped and the cause should be investigated. A structured program with gradually increasing activity levels can be beneficial, with structured follow-up, clinical examinations, and imaging studies as the athlete recovers from their injury. So basically, being in communication with the athlete and developing an exercise and workout plan that fits the athlete's needs and goals, while still prioritizing their safety. And then, of course, doing those imaging studies and continuing to monitor the athlete's injury. In conclusion, femoral stress fractures commonly affect those engaging in repetitive impact activities, especially long-distance runners. They typically occur in the femoral neck or proximal shaft. In addition, this injury requires advanced imaging for accurate diagnosis. Treatment varies based on location and type, so we have, again, those non-displaced or low-risk compression fractures that can be treated with conservative treatment, and then we have our displaced or high-risk fractures that have to be treated with surgery. And with proper diagnosis and treatment, outcomes are generally successful. So this concludes my final project regarding femoral stress fractures in high school and college female long-distance runners. In regard to my references, I chose 4 articles, and then I did use the actual book that was assigned for this course and 2 websites. I hope you enjoyed. Thank you.